because of these increased stress states, and that's one of the adaptive mechanisms by the body. What's happening is that the more that glucose is sitting there, the more difficult it is for the insulin and for the glucose receptors or the insulin receptors in the body to accommodate to all that, right? So you kind of start sliding down this road or this slope of blood sugar dysregulation there. Right? But it's in part driven by these catecholamines. Decreased blood flow to the brain and decreased blood flow to the organs. The reason I put the decreased blood flow to the organs in here specifically is because of the difficulty in healing the gastrointestinal tract. So one of these scenarios that pops up sometimes with this leaky gut is it's difficult to heal. I'm doing the work and it doesn't seem like it's getting better, right? And this may be one of the reasons that's happening. It's because there's these constant catecholamines being secreted, this constant adrenaline and noradrenaline, but it's a vitamin D driven or dependent process. Now, I showed you all that, but is there some actual solid evidence linking it into autism? Okay. So what this actually says is that vitamin D deficiency was found in some autistic children, and this deficiency may contribute to the induction or production of these anti-MAG autoantibodies in these children. So there is a role. And look at this. There's 6 more studies I just grabbed. Clear indications, autism and vitamin D. Autism immune function and vitamin D. So there's without question a link in this. The omega-3s. So what are omega-3s? Think about these as your fish oils, right? But you can also find them in, there's a lot of places you can actually find them. Just in your oils, you're going to find them in not just the fish oils, but you'll find them in your walnut oil, your hazelnut oil, things like your grass-fed meats are going to be higher in omega-3s. So that the content of the grass as opposed to the content of the grains is going to provide the omega-3s as opposed to the more grain-fed meats, which are going to be omega-6 is more inflammatory. Okay. But look at what this says, and this is the reason that I brought up the whole IL-17 issue earlier. The immunomodulatory effects of the EPA on these regulatory cells, right? So if we've got control over these regulatory cells, then we shouldn't be having issues with this Th17 popping up and starting to elevate and driving our autoimmune process. And here's what this says. This review up top describes the immune modulation effects of the EPA or your fish oils, is what those PUFAs are, of the EPA, and summarizes recent research have many implications for the development of therapies for autoimmune disease. So it's a factor. Now here's something else, and this is something I don't want you to get caught up in. Notice that this is, when we talk about fish oils, we talk about EPA and DHA. This study talks about EPA. Well, we turn around and we look at another one here, and this is talking about DHA. But it's talking about this Th17 in regards to autoimmunity. So it's the fish oil, the omega-3, that's important. Don't get bogged down in whether it's got this much EPA and this much DHA, because there's studies supporting both ways. Okay? Now, I wanted to be upfront with you in what I found as I was looking through this. If you go and you do a literature search on autism and omega-3s, most of those studies will say that they didn't really find a benefit for using omega-3s in autism. However, if you go and look at studies that look at omega-3s, which I just showed you, omega-3s in autoimmunity, they definitely show benefit. And there's a clear defined pathway of how the omega-3s affect the immune system. It was in that kind of elaborate chart I showed you, or graph. So here's really what this is saying, is that none of these studies are really focusing on the autoimmune aspects of autism. These studies are just looking at the general overview of autism. They're looking at literally what some of these studies I read, what they did is they gave these kids omega-3s, and then they went and asked the parents, well, did your kid get any better? That's not a very objective scientific method for following through with a study, okay? You gotta be a little bit more definitive than that. And here's the other problem with this, is that omega-3s, the way that they looked at these, they were studied in isolation. They didn't look at them with regards to what the vitamin D levels were and what the antioxidant status was. Because really, and you'll notice, again, think back, that T regulatory sitting there in the center, how many different things were going in and pointing towards those T regulatory cells? Well, I could have a great level of omega-3s over here, but what if I didn't do anything about the gluten aspect? Or what if I didn't do anything about the vitamin D or the antioxidants or the probiotics over there? I still got something driving my dysfunction. Great, I got all these omega-3s over here, but they can't carry the weight by themselves. They can't run every physiologic pathway in the body that's related to your immune system. Some of them just depend on vitamin D. Some of them just depend on your antioxidant status. Okay? So you got to look at it in a more of a synergistic manner. And these studies just didn't do that. And in fairness, most studies don't do that. Most studies look at things in isolation because you can control it better. The unfortunate part about that is that the body doesn't work in isolation all the time. Okay? And just from other studies, we know, again, some of the ones I just showed you on the previous slide, omega-3s have a pretty significant role in regards to autoimmunity. So, now, how do you look at these things? Well, there's something called an omega-3 index, where you can actually look at the red blood cell levels of the omega-3s. So you can get a definitive level of whether or not whatever dose you're given is actually having a therapeutic role. And what we try to achieve on these is we try to get at 8% and above on the level of EPA and DHA. Glutathione. So here's what this says. Glutathione is an antioxidant. It's what typically is thought about as the body's most potent antioxidant. So if we can have a higher level of antioxidant status, we can drive down inflammation, because these two are inversely related to each other. As inflammation goes up, antioxidant status goes down. But the more prevalent the antioxidants are, the lower the likelihood of inflammation. Right? So this study actually shows that the loss of glutathione may contribute to immune dysregulation in autism. Okay, so we got a link now. Do we have another link in here? So evidence of inflammation, oxidative damage is another way of saying inflammation, is associated with low glutathione in the autism brain. And this is what the final outcome on this is. Together, these results indicate that decreased glutathione capacity and increased inflammation in the autism brain may have functional consequences. Okay? So you gotta keep these antioxidant levels up. And realistically, again, just like with most of these things, having an objective measure by which to do that is critical, because only then do you really know if your therapeutic intervention is making a difference. So, leaky gut. So let's talk about this. This is everybody's favorite topic. You know what's really cool about this? When I started practicing, if I went and I looked in the literature for leaky gut, it didn't exist. And then it kind of evolved a little bit, and they got to the point where they would say intestinal hyperpermeability. Okay, so we're leaning a little bit. And now what you see is that they actually say leaky gut in the literature now. So we've come a little ways in the last few years, so this stuff is getting more prevalent. And this is actually, I don't know if you guys can see this down here at the very bottom, this is actually out of the journal Pediatrics. And what this says is evaluation, diagnosis, and treatment of GI disorders in patients with autism. And this is what they say. Care providers should be aware that problem behavior in patients with autism may be the primary or sole symptom of the underlying medical condition, including GI disorders. So this is important. This is something that we got to look at. We got to at least think that there's got to be some influence on the state of the child as it relates to their gastrointestinal health. So we can't forget about this. So when Mr. Link was asking me to put this together, one of the things that I wanted to do with you was share some of the newer testing information out there so that you could get a feel for what we're looking at now. And this is one of the newer tests. This is one of the tests that specifically looks at autoimmunity. And you'll notice that you got a couple different areas in here, and I'll actually show you on the next slide. a diagram of this so you'll have a visual representation of it. But this actomycin, these are proteins in the center. These are not just in the center, but these are proteins within, is a better way to say that. These are proteins within the cells of the gastrointestinal tract. These next three, this occludin and zonulin, these are proteins in between the cells of the gastrointestinal tract. And then these lipopolysaccharides, these are byproducts of bacteria in the body, or bacteria in the gut, really is what we're talking about here. Well, bacteria in the body, I shouldn't say bacteria in the gut. Because your immune system is a circulating system, so it can pick up a bacteria from, or it can develop a reaction to a bacteria from anywhere in the body. But basically, these proteins. Now let's look at this in a more illustrative manner. So if you look at these cells of the gastrointestinal tract, those first two, the actin and myosin I was talking about, those are in here. So if those are showing up, literally what has happened is that this autoimmune process that's damaging the gut has gotten severe enough that it's actually damaging the cells or the proteins within those cells. So it's creating quite a bit of damage here. The other two, or the next three that I brought up, the occludin and zonulin, those are within these spaces right here. That's where you're going to find those. So in an environment where you've got nice healthy tissue like this, you're probably not going to have an elevation in those antibodies. However, when you've got breakdown, as you see here, that's when you're likely to see an elevation in those antibodies. And that's when we can definitively say at this point now that, yes, there's a leaky gut. Those proteins that hold those cells together that tell them to come apart and relax so that food particles can move through them, when these proteins are being damaged by the immune system, this leaky gut is active. So it's not really about saying or speculating anymore. It's saying, yes, we have a definitive marker to suggest that that's there. And then I wanted to put this in just kind of to show you the relevance of this. You know, I mentioned those two probiotics, but look at what this says: the gut flora as a forgotten organ. So the significance, these are all bacterial species up here, but just as they maintain the integrity of that gastrointestinal environment, basically they're significant enough that they're looked at as their own organ system. Here's another one talking about this Th17 and how probiotics affect this. This is what that study says. Induction of autoimmune diseases by Th17. Again, so these Th17 cells produces IL-17, and if that goes up, autoimmunity goes up. Autoimmunity antibodies are going to increase. Targeted therapy can restore integrity of the intestinal and the blood-brain barriers using probiotics. So we know now that there's a therapeutic role to these probiotics. And then also this N-acetylcysteine, which is going to be the precursor, or one of the three precursors to glutathione. And then your other antioxidants like lipoic acid and resveratrol. So definitely your antioxidants and your probiotics play a role here. So this is just kind of a summary study where they look specifically at the role of probiotics in autism. And what this is saying is that there's a potential to ameliorate the behavioral symptoms associated with autism with the use of probiotics. Okay. So clearly a role. And this is just an overview of that perfect storm scenario where you've got multiple factors playing in here. You've got the genes that have an influence. You've got this immune dysfunction that's coming in because of things like the vitamin deficiencies, and then you've got the environmental aspect of this as well. Okay? So, you know, you really can't look at these topics that we talk about with regards to autism or literally any other condition in healthcare and just look at it singularly or in isolation. It's how do they all interrelate to each other is what we're talking about. So what's the systemic impact of autoimmunity on neurotissue? Well, it's this vicious circle effect here. And what begins to happen is that this dysfunction, this leaky gut that we talked about in the gastrointestinal tract, more or less what that's going to do is it's going to create inflammation systemically throughout the entire body. And as that blood supply, as that inflammation is driven through the vascular system, it's going to ultimately find its way back into the brain, and you're going to drive the inflammatory process in the brain. Inflammation in the brain it's a little bit of a different animal than inflammation outside of the brain. Inflammation in the brain, those cells, those immune system cells within the brain are very, very efficient in what they do. Not that the other immune system cells in the rest of the body aren't efficient, but once those immune system cells in the brain get going, they don't like to get shut down too easily, not like other areas in the body. So what literally starts to happen is that the feedback mechanisms through, you have what's known as a vagal nerve that communicates between the brain and the gastrointestinal tract. Literally what you see is that as the brain tissue does not function as well and as it's not as healthy as well, it doesn't feed down and it doesn't give the stimulation to the gastrointestinal tract that the GI tract needs to stay healthy. The best example I can give you of this is that there's literally studies that show that that an individual, like in a motor vehicle accident, when they have head trauma, that they have to, over time, really begin to pay attention to the organ function in these individuals, because over time they're just not as healthy as, say, an average individual within the population, because they just don't get that same neurological stimulation down to those different organ systems. So it's this vicious circle. And there's a lot of vicious circles in healthcare. Really what you have to do with these is that there's no real right or wrong place to step in and interact. You just have to step in and interact. Just break that circle somewhere. Start the process of interrupting this cycle of dysfunction. Now with these different nutrients and some of these other areas of dysfunction that we've talked about, how do you really go about getting a firm handle on what you need to do with these? Well, with the vitamin D, really the serum vitamin D is kind of the standard on this. You can look at intracellular markers and they definitely have their utility, but there's not a lot of research on those. The serum vitamin D is where your research is going to be found at. So, optimal levels on that are going to be above 60. So that's really kind of the levels you're trying to shoot for on this. The red blood cell omega-3 index, so really looking at whether or not there are enough omega-3s in the body. That's one of the better tests for that. I mentioned that the intracellular vitamin D doesn't have a lot of research on it, but your other intracellular nutrients, these do. There's some good literature showing that, especially with antioxidant status, your intracellular markers are going to be the best markers to go about looking at to really determine, do you have enough glutathione, do you have enough just overall antioxidant capacity in general, whether you're looking at, like that study mentioned, the lipoic acid, the vitamin C, the E, just all these different antioxidants that get talked about a lot of time. Your intracellular tests are going to be the better options to do that with. Your antibody testing, there's tons and tons and tons of antibodies you can test, like I mentioned. Your gastrointestinal ones, those are going to be, for the topic that we've been talking about, those are going to be one of the better options to look at. Your neurological markers, I showed you a couple that in some of those studies, those are more of the ones that get looked at in the research environment. But I also put in here some of the ones that get looked at with in the more commercially available labs. Now, interestingly enough, this GAD65 right here, you've heard glutamate, the term glutamate, right? Glutamate being like your MSG, being an excitatory chemical. Well, in the central nervous system, to take glutamate and actually convert it over to GABA, this is the enzyme that does that. What's happening, or what can happen if you develop an immune response against that enzyme, is that conversion from an excitatory chemical to an inhibitory chemical won't take place. Your GABA is the body's predominant inhibitory chemical. It's actually the one that's truly defined as an inhibitory neurotransmitter. Most of the rest of them are defined as excitatory. But think about that. It's the sole inhibitory transmitter, and if you've got an autoimmune response that is inhibiting the production of that predominant inhibitory neurotransmitter, how efficient is the child, or anyone else for that matter that's got this reaction, going to be at offsetting that excitatory activity? They're not. And ironically enough, one of the main things that tends to associate with this are grains. So this is a very strong reason to pull grains out of the diet, not just for autoimmune, but in general. And then the stool assessment. You know, you'll see, I did want the stool assessment in here. Take the traditional stool sample like we've talked about, because really when you look at these probiotics and defining whether or not there are enough probiotics, that's the best way to do it. That's the standard. So just to recap, there is a clear connection that exists between autoimmunity and autism. There is an investigation of the role of autoimmunity in the mother may provide insight for treatment. And nearly all of the more traditionally discussed areas of dysfunction within autism have some degree of autoimmunity related to them. Avoid the triggers as you can, and that really means identifying the ones that you can identify and the ones that we pretty much at this point know are problematic, the dairies, the grains, keeping those out. And then intervention should be diagnostically based and not trial and error. You'll drive yourself crazy trying to use a trial and error approach. So, you know, and really the reason that you do with that is because everybody's needs are different. What may work for, you could have, two people look basically the same, living in the same environment, but their needs just might be different. The 2 grams of fish oil that works for one person may not work for the next. It may take twice that much or 3 times that much to get the same beneficial effect. So, do the testing, find out what you need, have an objective measure. Okay, does anybody have any questions? Yes, sir.
Testing is just a date stamp, right? So when you do your testing, it's just that moment in time. So how often should you be retested to see where you are? So you know what you have to what you've made progress on and what you haven't.
Okay. Did everybody understand that? So here's what we have to differentiate in this. All tests are not a moment in time. They were drawn all at a moment in time. The traditional tests like blood counts, chemistry panels, lipid panels, things like that are looking at your glucose, your cholesterol, how your red and white blood cells are functioning. Those are moment in time tests, right? But then you run into things like for example, that intracellular test that I talked about. That has a window of 4 to 6 months. So as an example, if you had a B12 deficiency and you loaded up on B12 the night before, and I turn around and test you, or let me rephrase this. You have a B12 deficiency, we find, I take you for a week and I load you up on B12. Let's just, for the sake of argument, say I'm giving you injections on top of that, okay? We're loading you up. And then I come back and I check you a week later, you're still gonna have a B12 deficiency, okay? Just to really drive that point home, I'm getting ready to give a lecture next week to a group of clinicians on that very topic of why you can't just look at moment in time tests to really get an idea of what the status of a particular nutrient is in the body, and B12 is the example I'm using. These antibody tests, antibodies can cycle up and down, but in general, once they're elevating and the dysfunction that's driving those antibodies, it's not going to go away. So the likelihood that you're going to see these antibodies elevate and it's going to be something that's occurring over a definitive time frame is probably pretty likely. But the real question with looking at these antibodies is that if that antibody is there, there's a state of dysfunction. So to flip that around, if that antibody goes away, I still need to be cognizant about that state of dysfunction being there. Right? I still want to be proactive about keeping those antibodies under control, because if I've been able to identify what that trigger was and that trigger creeps back in, or let's say that the trigger is that there just wasn't enough omega-3 available to keep the whole system under control. I'm picking on omega-3s here a lot, but if there wasn't enough omega-3, then maybe those antibodies start coming back up again. Right? Okay. So some of them are a moment in time test, but we look at them over a much longer time frame. So, yes, ma'am.
So, are these autoimmune problems something that are present at birth or something that develop over time?
The answer is both. The ones that are passed from mother to child are obviously there at birth. But then you kind of run into, actually let me go back to this. Let's say you've got the genes and you've got an environmental exposure, but your immune system's keeping it under control because you've got adequate, just to use the ones that I talked about, vitamin D, your antioxidants, your fish oils or omega-3s, your probiotic. If you're good on all those, then theoretically this should develop because you're keeping your immune regulation very efficient. But what happens if you develop a vitamin D deficiency? I literally, when I was looking through this, and I saved this study, think about the population in the world right now. There's somewhere between 6 and 7 billion people in the world at this time. This study I looked at literally said it is estimated right now that over 1 billion people in the world have a vitamin D deficiency. So 1/7 of the Earth's population is predisposed to developing an autoimmune condition. And they can develop just by virtue of some state of immune dysregulation.
It seems to me that we diagnose autism on the basis of behavior. So how do we connect behavior with autoimmune deficiencies? How does autoimmunity present itself in behaviors?
I'm not going to be able to give you a clear answer on that because it's so individualized. But if you think about, let me do it this way. Because again, those early studies did show a correlation between severity and the severity and elevation of the antibodies. So as the antibodies went up, the severity of the presentation goes up. Really what that's talking about is that those classical criteria are exacerbated. So I don't really know a better way to say this right now. If you look at them on a scale of 1 to 10, they would be pushing away from 1 and moving towards 10. Right? But it's the individuality between individuals doesn't give you a clear definition or a clear, what's going to happen when those antibodies go up. It's hard to say. We just know that overall that the child's probably not going to be, they're probably going to be more agitated. Maybe stimming, stimming is an example. Maybe they'll stim worse, something like that, or be more prone to it. It'll happen more frequently, or maybe it happen for a longer period of time. Those types of things.
As far as like language acquisition,
it's going to be more
social awkwardness, those kind of things.
And it's difficult to say because, with some of my autistic patients, the social interaction is almost non-existent. But with other patients, it's they're very social with me. And the therapeutic interventions I've kind of worked them through my own personal algorithm the same way. I've kind of worked them up the same way. And we're addressing what their needs are, but there's still those individual differences that make them unique. So if their antibodies increase, how are they going to become more or less social? I don't know. It's really dependent on the individual. It's kind of difficult to give a blanket answer on that. And I know that's not really giving you an answer. But that's just clinically how it presents. What I typically will do with this, if a parent presents to me with an autistic child, we'll kind of take an estimation of, what the habits, what the routine of the child are, kind of how they are throughout their daily activities. And the parents interact with the kid every day, so they have a really good assessment on that. And we'll look at, as we go through the treatment algorithm, are they getting better? Are they seeing an improvement in some of those? Again, since it's on the top of my head here, like the stimming. Are they getting better with the stimming? Is it less frequent? Is it, not happening as often? Things like that. If it's a non-social child, are they socially more interactive? So, do they become less or agitated less easily? Anybody else have any questions?
And then you're saying, like vitamin D, it isn't just a matter of going outside and getting extra sun, right? You have to take supplement.
You do.
How do you know how much to take?
You have to check it. I mean, it's the honest answer.
Is there something that depletes vitamin D from your system that you know about?
Well, I can kind of take you through some of the roles of vitamin D, and I think what's happening is that the vitamin D is getting used more readily to offset some dysfunction. Immune dysfunction is one of those. Blood sugar regulation is another one that comes to mind really quickly. So what's happening is that with the blood sugar dysregulation is that the pancreas, the cells in the pancreas are heavily dependent on vitamin D to keep them functional. So, you know, if somebody, let's say somebody's eating a poor diet and they're eating a lot of carbohydrates, then there's going to be a higher need for insulin production. So they're going to put more of a demand on their vitamin D to support those cells and those beta cells in the pancreas. Typically what I look at with this, or what my experience has been, is that nearly all, and it makes sense now based on what I just shared with you about that 1 billion people in the world, nearly all of my new patients, unless they're coming into me already supplementing vitamin D, are deficient in vitamin D. What I should say, let me rephrase that. They don't have optimal levels, because deficiency, the cutoff for deficiency technically is at a 30, but 30 is not, if you get 31, you're not in an optimal state. Or if you hit 40 or 50, you're not in an optimal state. You're getting better, you're definitely better than you were, but above 60 is really what's at an optimal level for vitamin D. So typically we'll start around 10,000 units a day, and we may do that for 4 to 6 months, and then after that, after I see that those levels are up above 60, I'll pull back to 4 to 5,000. So, my experience has been that some people just won't budge at 4 or 5,000 units a day. You gotta use higher levels. So that's the reason I start with a 10.
Would that be toxic though if you take too much vitamin?
It's not toxic.
Because some of the vitamin I know is like water soluble, it will leave your body, but some like it will stay.
Right, so the vitamin D, you're right. Vitamin D is fat soluble. And the biggest problem with vitamin D is not really so much the toxicity aspects of it, it's the interaction that it has with other fat-soluble nutrients and the potential to push down those other fat-soluble nutrients. The A and the K tend to be the two to consider the most, but E is also a consideration in there. But I can tell you in, again, 10 years of practice, I've had 2 patients that actually went too high. One of them was new to me, so she came to me with a high level, and we just found it. And I just told her, I said, just back off. She didn't have any symptoms related to it at all. And then I had kind of a small frame lady who was doing a 10,000, and hers went over 100, but she didn't notice any symptoms with it either. So, I don't really see a toxicity related to it. It's more of an interaction of how it affects those other nutrients. And again, to get someone over that 100, it's pretty, you've really got to be, pushing a lot of vitamin D. And 10,000, like I said, for most people, is not going to do it.
When you said 10,000, is it milligram or?
It's what's known as international units. That's actually the standard unit that's used for vitamin D.
Since you're talking about the immune system, what role does vaccinations come into this?
All right, let's cut the camera off.
Oh, come on.